and your master's program, the whole thing to be able to work. It's your Clinical Certificate of Excellence. And then SLP, Speech Language Pathology. So, yeah. All right, so speech language pathology is a really broad scope. A lot of times, something I always like to say that you can do it from birth to death, which I'm sure that you guys can kind of relate. You start when you're really little and you can go till you're ending your life. So it's very, very fascinating. The main scopes that we're going to get into today, which you'll see on the next couple slides, are voice disorders, which I really love. I took a big fond of that in grad school and studied that pretty closely. Cognitive disorders, so that's a big overlap of us. Fluency, social skills, language disorders, hearing impairments, AAC, speech sound disorders, and so we do a lot of different stuff. A little bit about me. I went to Temple University for my undergraduate degree. Pretty cool, I'm sure. A lot of you guys have heard of it, at least maybe been to it. I really had a lot of great experiences there. I love language, so I studied Spanish and sign language while I went there. I was also lucky enough to do a study abroad program with the recreational therapy department. Did any of you guys have that as your major in undergrad, recreational therapy? Okay, well, a lot of the people from my school go into OT after, and it's really, really fascinating, and it's just about how to turn, your recreation, your hobbies into therapy and make it more valuable for your life. So I went there. It was just by chance. I wasn't supposed to, but I just kind of fell into it, and it was really lucky. We got to go all sorts of places, volunteering at orphanages, which was birth to death. There was a war there, so there were some people that were like 80 years old who were still at this orphanage with all sorts of disabilities, and that place I could talk about for hours. And then we went to adult centers, we went to schools, so that was just a great gateway into the field for me when I was a junior in college. Then I also got to work at a camp that Temple hosted doing AAC devices. Have any of you guys ever seen one? Yeah.
That is another area where we definitely overlap.
Yeah.
We do a lot of training for AAC, like you're the ones who recommend which one.
Yeah.
And we might be the ones who help them really employ it into all their activities.
Exactly. So which I'll get into in a little bit, I work very closely with a lot of occupational therapists. So we'll get into that in a little bit. But then I also went to Adelphi University that is on Long Island in New York. It's a pretty small school, but it was a really great program. I went during COVID, so I graduated in 2020 from Temple, and then I went to Adelphi. It was very interesting. It was half online, half in person. Everything was changing, so my experience was very unique compared to others. So don't take being in person for granted. It was really fun, but it was crazy because all the girls that I went to school with, I had to become friends with them online. So there was group projects. We really had to get to know each other, and it was all just virtually. So then when we all finally met in person, it was very surreal feeling, very funny. When I was in grad school, I worked at a bunch of different places. I had an outpatient placement, and that was mostly 3 to 5 year olds. And then I worked in elementary school, kindergarten to 5th grade. And I also did a transgender voice clinic job, which was really cool. I'm going to get into that a little bit more today. It's not something that you guys might deal with all the time, but it's still just really cool to know and something near and dear to my heart. So it's another one of the things we're going to get into. And then I also worked with and ran a group of adults with aphasia, which was very interesting because that was on Zoom, and there was all these people who barely knew how to work the computer, and we were trying to wrangle everybody in. So that was a whole experience in itself. So that's a little bit of my educational experiences. So I graduated in 2022 from grad school, so this is my second working year out. Last year, I was contracted into a school, and I loved it so much. I worked at 2 of them, kindergarten to 5th grade, and a lot of my sessions were only 15 minutes long. So it's going to be something that we talk about a little bit later in an activity that I've planned, is how you would manage your time. I played a lot of Uno that year. I love articulation, something that we're going to get into a little bit more. I keep saying that, but just to preface, articulation is your speech sounds. So I have a fun activity for you to learn how to do those too. And working at the school was very interesting because I collaborated with the OT. The OT at the school versus my current job did a lot of different stuff. So it's very, very cool to see the different scopes. But so at the school, I'd work with the teachers, I'd work with the specialists. I would go to art class with this one kid all the time. I was best friends with the gym teacher. His room was right next to mine, so I would go in the gym all the time and play basketball with different kids. So that was a very interesting in itself, and I mostly worked with kids working on their articulation sounds and then their language skills. Now, I'm in an outpatient center, and that is birth to 21. I mostly am with like the 3 to 5 year olds, which I worked with in my outpatient. But now I work with physical therapy, speech therapy, and occupational therapy. We have a lot of co-treatment sessions, which are very cool because, you know, I'm still new to it. I'm still learning, and a lot of these girls are very smart, so I use them to my advantage. I'm learning stuff all day. If I have to cancel, I'll go watch a session of theirs because, you know, I love learning. Big thing that you guys should use in every interview is that you're a dedicated lifelong learner, because that's what we're in the field for. We want to get better every day. So that's where I work now. So then just get into a little bit of who I am. I'm going to be telling you guys a lot about it, but you all need to remember, like, you guys are students. This is a rigorous part, but you're still a person. You need to have your own life. You need to be able to have a nice work-life balance. So professionally, yeah, I'm a speech language pathologist. I work a lot. I get stressed out, I get overwhelmed. My husband's a teacher. We at dinner, we talk about my students and his students all day, and we're like, all right, we gotta cut it off.
She's a newlywed.
I'm newlywed. I got married in September, so here's a nice picture of it, because on top of all that, I also come from a gigantic family. Grace, that's my sister, connected me and Allison together because she's doing my hair. She's her hairdresser. So this is just a glimpse of my family. I have 11 nieces and nephews. 2 of them are not born yet, so that's news. Pretty exciting, but I'm still gonna count them in my number. They're real. So yeah, I have a huge family, and it was very cool for me because when I was in high school, I didn't know what I wanted to do. I've worked at an ice cream place, a real estate office, a hairdressing office, like a hair salon. Like, I did everything, and I just knew I liked talking to people. I went to Temple as a business student, and I thought, I hope that I can go somewhere that I can go to luncheons or something. I better pick up golf. I had no idea what I wanted. I went to business school. I wasn't that into it, but this one, Danny, he was born when I was a junior in high school, so he was about 2.5 by the time I finished my freshman year, and I was like, I don't know. So he was getting evaluated to get speech therapy, and I changed my major that week because I thought it was so cool. I loved it. My sister Megan, that's my brother's wife, this is like a big stretch, so it's nice of the visual. Her sister is a speech therapist at CHOP. So that same week, I was able to shadow her for an entire day, and I was like, this is what I'm gonna do. I love it, I'm excited. And so yeah, there's a lot about me. These are just some things that I'm gonna share with you right now. Really exciting, and I took off. It was a long process to get through it, but now I made it to the other side. You guys will too. So just to give you a little rundown of today, this is just the order of stuff I'm gonna cover. It's a lot of information I'm gonna be throwing at you. Some stuff I might have more on the slides than what I say because, you know, it's just, can't talk about everything. There's a lot of stuff that you have to do, but I figured I'd put it all down in case you guys ever are curious and want to come back and look at it. So if you ever want it, it's here for you, and you can always reach out to me. I would be happy to help any of you. So let's just get into it a little bit more. So speech therapy does communication and swallowing. I'm going to be completely transparent with you guys. I don't like feeding therapy that much. I don't like swallowing. In grad school, I was like, I don't like this. I don't like it. It's not something I've ever really been into, but at my new job, that's something that they do. They do feeding therapy for infants. They'll teach parents how to do breastfeeding with their babies that are just born, how to chew when you're 1.5, how to swallow. I still avoid those patients. If they're on my schedule, I'll do a little swap with somebody, but again, those are one of the ones that I observe. I'm taking a continuing ed class on it. Something I plan to learn a little bit more about, but just to be completely transparent with you guys, I'm a little curious. Just raise your hand if I'm curious about where you guys want to work when you're older or when you're done this, I guess. So who is more interested in peds, just by a raise of hands? Okay. Does anyone want to work with adults? Okay. I think I didn't see, did anyone not raise their hand and have like a different interest?
Jerry.
I'm sorry, one more time?
Geriatrics.
Okay, cool. Very nice. All right, so we're a little bit split half and half. Very nice. Okay, so we'll just start off with my favorite, articulation. I thought that this was funny because all day I am looking at people's tongues, right? I'm like, stick it out, let's see what we're doing. Literally all day. I carry a mirror around with me. I actually almost brought it, but I did not. But yeah, let's see it. We're dealing with what we're doing. And this is my favorite. I love it. I've loved it from the beginning. I think it's very cool. So this is an intimidating chart. We were given it in grad school, or in undergrad, and we had to fill it out. They gave us the boxes. You had to fill out the top, you had to fill out the sides, and all the middle. And me and my classmates were like, they're insane. How do they think we're going to know any of this stuff? Like, what does this even mean? I have no idea. I clearly know it now. It's something that I think about and reference all the time. And so let's just get started into a little bit of the articulators and places of articulation and how air flows. Because it's a lot more than you think it is, but it's also very simple, if you want to say, but it's interesting. So this top part is your place of articulation. So that's where we'll start now. So bilabial, 2 lips. Ba, pa, ma, wa. So that's both of your lips are doing those sounds. If you guys want to do these sounds, you can feel free. I'm going to make you do it at some point.
Let's be her clients.
Yeah, all right, everybody do a B. Now do a P, and then do an M. Okay, so there, we'll get into a little bit more. These are just stops, so it's just the airflow. The M is nasal, so the air goes into your nose a little bit more. That's why you might feel it buzz a little bit. Okay, so labiodental, lip, teeth. So F and V, you bite your lip. So this is something we're going to get into a little bit later, but those two are pretty clear. If they're in the same box, they are the same sound. So the only difference is voicing. So F, now V. The difference is that your vocal folds are touching in that, and I will show you that a little bit later. All right, so dental is your teeth, right? So that's the TH sounds. There's one that's voiced, there's one that's not. This thing. Then, so it's just sticking your tongue and touching your teeth slightly. This. I like working on that sound. It's nice. These ones are the easiest ones to teach, in my opinion, because they're visual. As we get further back, you get further into the mouth. So alveolar sounds. These ones, T is your mummy sounds. That is, if they can do T, you can pretty much try to teach them the rest of them. So T is right behind your teeth. Do you have a whiteboard marker by any chance? I might have one.
I do not.
I think I have one in my pencil case, actually. Let me see. So just so that you can see what I draw this on a piece of paper almost every time I talk to a parent. Yes, I do have one. Okay, so right here is your teeth, right? There's a little bump there, and then it goes all the way up. This is your alveolar ridge. That is where you make your T and D, and your S and your Z and your N. But I always start with T because T is easiest. It's voiceless and it's a stop. So it's right on that bump, and we're gonna get into it a little bit more, but I use that muddy T to teach pretty much every other sound in that area. Then we go back slightly behind that bump, and that is where you get your sha, your ja, your cha, those sounds. So it's just millimeters back, but if you do an S, everybody can try. Now you're gonna feel your tongue go back so slightly, and you're gonna round your lips. Shh. So if you wanna sing, but you say shing, sing, shing. Or you need a sip, but you say ship, ship, sip. It is such slight movement, but it makes a big difference, and it affects how your air flows. So that's how we get back there. Then we're gonna get into the Y. That's ya. Does anyone have any guess on what people turn ya into all the time? What sound turns into ya? I yike that. Kids always turn L's into ya. So they go back a little bit more. But L, right there on that alveolar, that's the front of your mouth. La, ya. So then we're getting all the way back to our velar sounds. A K, those are a nightmare to teach. Yeah, so that you have to go all the way back, and a lot of kids turn those into T's. So it's a very difficult thing to teach people. Something I've been doing a lot lately is having them just lay on the floor, let their tongue fall naturally back from gravity. And I've been making them so we'll get into the vowels a little bit in a couple slides, but then I'll show it to you then. You have to combine the appropriate vowels with the placement to make it harder. It's easy to say T because your E and your T are in the front, but ta, it's a lot of movement going on. So that's just a little rundown of the sounds, and we'll see.
Can you pause for a second?
Yeah.
So she put her client in a gravity eliminated position for the tongue. Just, right? Right? Continue.
Cool. Okay, how do we get this? Okay, so this is the next chart that I was excited to show you about the vowels. This is my favorite. I show it to people all the time. This is what they give you in grad school to memorize. It's a lot easier to do it this way because I like that it has 2 words and it's color-coded. So if you're going to do a T, it's good to do E. This is your mouth, by the way. This is what your mouth is, and it's a map. So your E is up high, E, and by up high, I mean your tongue, the front of your mouth and the place of production. It's in the top part of your mouth, E. But then let's say we want to do aw. Your tongue is going to be back and down, aw, and you're going to be making it down here, aw. So sometimes I've been teaching K caw, and I'm make a crow sound, caw, caw, caw.
Oh, I like that.
So, or coo, those would be good. But kite, that's a lot more difficult. So, cat, so it's harder, and a lot of times people will do tat. So you just have to be very strategic with what words you're going to choose. Is a nice even place that's right in the middle. It doesn't take too much control to do. So that's just a little rundown of the vowels.
Does anybody in here sing, or did you ever sing?
That's a great question.
Sing for fun.
Great.
But not with
Yeah.
with instruction.
Oh, nope, can't sing for real. But for
Okay,
fun.
we will get into that a little bit more because I have a lot of background in voice. Let's see.
Oh my gosh, she's so annoying today.
Okay. That one we can just skip over. So phonological processes. So these are errors that happen all the time, and it's something that you have to reprogram the brain basically to do. So repetition is important. I was kind of giving you a little bit of a background for that. So one of the ones that I said was fronting, tat for cat. So that means that you're changing that back sound into a front sound. Say the opposite, your back sound turns front. Gog for dog. One that I had in my life is my sister just got a dog. Her baby is 2, and he has been calling him Pucky. Not puppy, Pucky, that back sound. We were talking about that earlier. Puppy, Pucky. Because that sound is back there. It's easier to make it. So those ones are good. Then there's stopping. So I didn't really get into that. I can go back a little. I will go back a little bit just to get through these side ones. So these are very interesting. This is how the air is controlled. So stop, that is just a burst of air. Stop. So it's have you guys ever recorded your voice and you see the sound charts? We would have to read those sometimes in class. They would show it and they'd say, so what do you think they said?
That's so cool.
It was so hard. I remembered it was Steve is wearing a red cashmere sweater. I'm I don't think I got all the points on that one. But, so that's stop. It's just a burst of air. And on a sound wave, it would look kind of like low stuff, lots of stuff, and then low, because it's just that big burst of air. Then there's fricatives. So, P, you can't do that sound all day. You say it, it's over. S, you can, if you have enough air support, you can do an S all day.
Yes.
So that is a fricative. That is just straight airflow. Affricate, same thing, but there is just a little bit less of a slit and different placement. So these sounds are made by how air can, reverberate off of other sounds. Your S is made by a slit created by your tongue, letting a select amount of airflow hit the back of your teeth. So that's what that fricative affricate is. Nasal, the air goes into your nose. And then liquids and glides are very interesting and a little confusing. So we don't really need to get into that. Because R is the hardest sound of all, and we will talk about that one a little bit later. All right, so this is what I was telling you a little bit at first. So alveolar ridge. money spot. That's how we're gonna make our S. Here's it on a map. It's this bump right behind the teeth. Mine's a little bit more simple of a drawing just because, you don't need to see everything there. That bump is what we're looking for, the alveolar ridge. These are the other articulators that you will have. For S, it's just constant airflow created by the slit. I already said all of that. Then Z, same thing, except you have voicing. Your vocal folds are going. So everyone go like, ah, ah. You feel a little vibration in your throat? Okay, now do an H. There's nothing there. H is the easiest sound to make because there's no constrictions in your vocal tract. It's just a straight airflow. Z though is a little different because you're gonna love this video. Most people find it very strange, but you're gonna see what your vocal folds actually look like when you're doing voicing. It's a little
Here's a
weird.
look at some normal young female vocal cords during a stroboscopic exam.
Yes, exactly.
Yeah. So as you guys saw throughout the video, they did not look the same. It wasn't just moving. She was making a bunch of different voices, right? She was using a lot of different sounds. She was going high, she was going low. And the way that they were configured, if they're stretched thin, it's going to be a high-pitched voice. If they're not, then it's going to sound a little bit deeper. Very interesting, Teaching voicing is a hard thing to do. I usually will have some kids, like a lot of times I have this kid who instead of saying web, might do wet. No, wed, wet. Like he doesn't put that last sound, bed, bet. Like he doesn't put that voicing on there, so I have to teach him how to make that sound in there. So, you have to learn how to turn those vocal folds on. Sometimes with V, I'll be like, all right, turn your vacuum sound on, bite your lip, feel that buzz. So it's very interesting. We'll get into how they work in a couple slides.
Here's a look
not
at
again.
some normal young female vocal.
Okay, here we go. So the science of sound, it's very complicated and we don't need to get into the nitty gritty, but again, I thought that you guys would like to see that. So sound is basically made by pressure of particles moving. So the louder you are, the more intensity there is. And so there's intensity and then there's frequency. Intensity is like how hard it is, and that will make the noise. Frequency is like the vibration rate, and that will be changed by how thick the vocal folds are or how they, so with men, they're a little bigger, their voice is thicker. With girls, theirs is usually thinner. So that's why women's frequency is usually like 180 to 250, men's are 100 to 150. This is the speech sound banana, and it's nice for hearing loss so that you can hear the different sounds. And I talk about hearing loss a little bit later. I just thought that this was all cool, nice visuals. Okay, so I already said this, the vibration is what makes the voicing. And this is all stuff that you're not really gonna need to do, but it's just stuff that we have, so I just thought it was cool. So the frequency is the number of cycles per second. The higher the frequency, the more cycles. And you can see waves everywhere. You see them at the beach, you see them in water, the ripple effect, like same thing. That's what we were studying, and it was very, very cool, very hard, but the main takeaway is the thinner, more tense the vocal folds, the higher the pitch. The thicker and the more relaxed, the lower. So like, So that is a lower pitch. And you do that with instruments. It's a lot of different things that we can do, and our vocal mechanism is an instrument.
Can I just give an example
Yeah,
for a moment?
Sure.
If anybody has ever seen a guitar,
Mhm.
okay? Guitars have thick string on one end and then they get progressively thinner. Thick string equals lower note. And when you pluck a thick string, you can generally see the vibration as it waves back and forth. Thinner, it's much harder to see because it's waving so much faster, right? So both of those things are going to give that sound. Also, what does frequency, amplitude, all of these terms remind you of? Ultrasound. Yes. So we have learned about this type of physics just for a different application. Very similar though.
That's cool.
Mhm.
Okay. So yeah, we already kind of went through all this. Okay, so now I want to tell you guys a little bit about voice disorders. So I really enjoyed this. I thought it was pretty cool. I mostly worked with, like I said, people who are transgender trying to switch their voice. So we had to look for this kind of stuff. So glottal fry, that's, my voice is sounding like this a little bit right now. My throat's pretty dry, and that's that popcorny sound, or like that when you're kind of talking a little bit lower and it gets a little scratchy. That is fry, and that's kind of like strange triangle. A lot of these sound very similar, so it's a little hard to, but then breathiness is kind of like this. And you see a lot of this stuff with people with Parkinson's because they have a hard time controlling their vocal folds, and a lot of other, motor disorders for when you're adults. You see a lot of difficulty controlling your vocal folds because you're getting less control of the rest of your body. So these are some of the goals that I would have for people who are transgender trying to switch their voice. A lot of them would have really tight voices because they were pressed. They already started as male, they're trying to go to female, and they're so tense and trying to go up a little bit higher, and it's causing a lot of strain in there. I thought it was interesting because whispering causes almost as much damage as screaming because it's the tenseness. When you're whispering, you get very tight in here. Same when you're yelling, you get so tight, it's a lot of damage to your vocal tract, so you need to be very delicate with that area. I'm gonna walk you guys through a jaw release exercise next, which is very cool. The first time I did it, I literally teared up. I'm like, oh my God, I did not know what I've been doing to myself. So the main things that you wanna do is reduce effort, get that pressure away from here and move it into more of a head resonance. And you do that by having more ease, more breath support. So, sometimes people take breath, they puff up their chest and they're still speaking really hard here. But then if you have nice diaphragmatic breathing, you got that support, it makes it a lot easier to talk. I took that breath. You can definitely hear the difference in my voice from here than here. It's all about how your air flows and how you can protect your voice. So that was something that we did there, and it was very cool. We did a lot of different things by breathing through straws or singing and just practicing speaking on that nice melodic pattern. So it was very cool, very interesting. One thing that I was very grateful to be able to do. So now we can get into the jaw release exercise. So I'm gonna ask everyone, if you have something, just put it down and sit up. Close your eyes too. So I'm sorry, I don't know your name, but so you want to sit up all the way. You don't want to be leaning over. You can put your hands on your lap, both feet on the floor. All right, so just, close your eyes. Have a nice, even breath pattern. I don't want that chest to puff up. Feel it in your belly. Nice and relaxed. Okay, so I want you to start feeling the muscles in your face. There's a lot of them. We're going to start by relaxing your forehead. You have a big, wide, open space there. Your eyes are getting heavier. Gravity is naturally pulling down those cheek muscles because you're relieving that tension while maintaining that nice, easy breath. Keep your tongue on the floor of the roof of your mouth. You're going to start feeling it get heavy. You're not going to force it open, but you can let your mouth open now. Gravity is going to start pulling it down. Again, do not force it. And have that nice, easy breath. I can can see a lot of you, it's already falling down a little bit. If it's not, don't worry, you've never done this before. And as you start feeling it, you can slowly start to tilt your head back. And you're gonna feel the stretch of your neck. Your mouth is gonna open maybe a little bit more. If you feel a little saliva in your mouth, you can swallow it and go back in that same position. Let your tongue rest on the floor of your mouth. Keep that nice, easy breath. You feel your neck is very long, your face is very relaxed. Whenever you're ready, you can slowly move your head forward. Sit in that for a second. You might feel a little bit looser. Whenever you're ready, you can close your mouth and open your eyes. So do any of you guys, like when you're nervous, clench your jaw? You're stressed, you do that. This is a very important thing to do because you know that can cause a lot of damage when you're sleeping too. You grind your teeth, it hurts. When I was studying this stuff, I was very anxious, I was very stressed out. And then I had the awareness of this. I'm like, oh my gosh, I need to stretch this all the time. So, you know, I did an abridged version of it just for time's sake, but usually it takes about 5 minutes to do. Our voice clients would always be instructed to do it, you know, like 2-3 times a day. And just to loosen up that area because it's all connected and it's a very important thing. And I thought you guys might like that. It's a good one. Sometimes my friends will be like, hey, can we do the jaw release? I need that. So now let's circle back to a couple sounds. We're going to do an honorable mention of R. Like I said earlier, it's one of our hardest sounds to do. So say the word car.
Car.
Now say raccoon.
Raccoon.
Those do not feel the same.
Oh.
Car, raccoon. So there are, in fact, 8 different types of R, and I will give you the examples of them. So there is the R, the classic one, our pirate sound, R. I usually teach people that by saying, like, something's cute, R. A lot of times, that's a back sound. I'll think of a word with a K in the end because I want us to think of that. They can do K. Ark, park, to bring you back in that natural spot because a lot of times it might sound like caw, park. So it's that tongue dropping, so we got to keep it up high. Then there's air, Mary, that's right, so that's always a nice one, airplane. And if you know, does anyone notice anything about, not this one, actually, yeah, this one, any of them. Does anyone notice about the placement of the sounds?
That one goes down.
We have one in the final position, one in the medial position, and one in the initial position. So we don't just target, you know, R. We're going to target R in the final, R in the medial, and those are going to be separate goals. So that's not just one. So it's not easy to just solve it because there's so many different things. You start out at the word level. Sometimes you start out at the consonant vowel level, then you work up to phrases, then sentences, then reading, then conversation, structured, then spontaneous conversation. So it's not going to just happen like this. I can tell them how to do it, but you need to just practice and build that muscle memory. So those are those ones. Then there's Everybody knows that one. Ire. And then there's ear. I always like to start with ear because E, like we know, is that high sound. If you keep your tongue up for E and just drag it along the roof of your mouth all the way back, ear. I'm like, no. I have a mirror, they round those lips, they drop that tongue. My hand is my tongue when I'm doing speech therapy. Ear. Ears. Then there's or. Or's hard because you have to have that lip rounding component of it. Or. A little complex. Then there's the pre-vocalic. Those are the ones that come. So those are all called the vocalic R's. So they're a vowel and an R. And there's the pre-vocalic R, which are the ones that come at the beginning of words. So that's red, read. So that's a little bit harder, and you have to, I'm always like, all right, let's make our angry dog sound like red, rough. Then there's the R blend. So R's are just, you know, a nightmare for everybody. Break, freckle, great. I didn't put this on there too, but then there's the IRL. So there's girl, world. So you have to bring your tongue up for that L. You have to go, I always do them. It's like a circle with your tongue. So ours are hard. They're tough, but they're cool. So now I'm going to play you guys a song. You can get into groups of probably like 3. And then, because there's 30 of you guys. So you can get into groups of whatever. If you have like a pencil or a highlighter, that would be great, because then I want you guys to pick a representative and you guys can all pick your sounds and go through it, and we're going to find all of your sounds, and we'll do an example for each of you. Oh yeah. I don't care. I just said groups of 3 because there's 30 kids in the class, and I did 10 sounds.
Actually, it's 30. Yeah, it's fine. Between 2.
It doesn't matter what. It really doesn't. So just pick what sound you want to look for, and then you can tell me. You can.
Cool. All right, so we're picking a sound we want to look for.
Yeah. And I listed all of the sounds at the top. Okay, so I heard you. SH and S are not the same, so keep your eyes peeled for that. If you see one, and that would happen with my students. This is an exact activity I do with them all the time. 'Cause a lot of kids don't like reading, but they like music.
Okay.
So like shed, for example, is not an S, that is an SH. Right?
Yes. I love it. We're good.
You're the one that said her one.
All right, let's see what sound did you pick?
I didn't have
Okay, cool. Those ones don't have too many tricks in there, but I'm curious for like the person who did S. There's a couple, so like I heard somebody say nice, so like that final C, yeah.
That one doesn't work. Oh yeah, yeah.
Oh, I missed
That final F.
Oh my gosh.
Different.
Oh, yep. Good one.
I guess I didn't even try.
Yeah, man.
This is harder than you think.
What do you guys think?
Yeah, you don't have to do the whole thing, but just like for you to get a little taste of it. I can play the song, but we don't have to, so that we can keep going through it. But that is a real activity that I do with people all the time. So it's a little bit harder to find your sounds. She didn't find her final F sounds for a couple of them, right? She
failed.
missed F.
I missed if.
She
I
missed
missed differ.
So that was a medial. So some of them are just not as obvious as you'd find. So did anyone do S as their sound? Or what sound did anyone pick, if anyone wants to tell me?
You did shush.
Yeah,
You did.
our group and that group did.
Okay. All right. So the first one that I see is I'll just use. Do any of you guys want to be a volunteer of how I would do speech with them?
Like when you just read them out.
No. So I would pick one out and I'd show you what I'd do. Do you want to be it?
Oh, sure.
Okay. So sure, that was one right there, and I'd be like, okay, that's 1 point. All right. So the first line that I see in SH in is I ain't the sharpest tool in the shed. Did you get sharpest and shed? All right, so let's start with shed because that's a little bit short of a word. So say shed.
Shed.
Good. Did you make sure your lips are round?
How do I do that?
Like a kissy. So then I would have my mirror and I'd say, okay, you round those lips. Shh, pretend you're gonna kiss. Shed. All right, say it 5 times. Shed.
Shed.
Oh, too quick. If you were gonna do a jumping, and this is nothing personal to you. I'm just showing you how I would do speech. Shed, 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 shed. All right. So if you were gonna do a jumping jack, is it better to do jumping jacks like this, or do you need to do the whole thing? Shed, 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 shed. So you actually really think about what you're saying. You're building that awareness. You're feeling how you are.
And that muscle memory.
You're building that muscle memory. So then I'd say, all right, you got shed down. Let's try it in a phrase. So then I wouldn't do the whole thing. I would probably just do like in the shed, in the shed. All right, great. High five. Let's keep it going. And that's how it goes. So that I mean, you definitely felt like I was like being mean to you. So like that's how it goes. It's a very insecure thing that people can have, and you have to be a little bit delicate about it. I'm a loud person. I'm confident, so I just get a little taken back sometimes when people are like, oh, oops, I'm like, no, you're perfect, you're doing great, and I never say things are wrong. I'm like, that just sounds a little off to me or a little funny, and then I'll say it like that. So let's say they said like said, I'd be like said or shed, and then that is a minimal pair. Minimal pairs are words that are the same, just differing by one sound. So that is how a therapy session would go with me if it was an RTIC kid who is up to the reading level so that they can get there. All right. I was gonna play it for you guys, but we'll just skip this.
In the highest.
Just because I'm taking a little longer than I thought. All right. So, big things that I use for articulation therapy are mirrors, lollipops. So I have lollipops with me all day. So if I need them to make that T sound, I will have them suck on it. I'm like, get that flavor going so you can really taste it. Then I rub it on the front of their tongue, and then I rub it on that on their alveolar ridge, so that they can feel both places for connection.
Are you confused? Just intrigued. That was an intrigued face. She was like,
And then you can do that with popsicle sticks. I feel horrible when I do that because they are like gagging like crazy, and it's horrible, and it's I'm like, I'm so sorry. The lollipop is at least a little bit more appealing. I have this mouth mold, which is basically like a big mouth puppet, and I can do that with my, like, show them like, okay, the tongue goes right here. It's just a little bit harder to use. I wish I had a different one. And then gloves, because I'm sticking my fingers in their mouth. I'm gonna put some gloves on if I do that. The other big things that I use all the time are co-articulation. So my big thing for S's are my exploding T method. I do T, blow that sound up, that's how you get a perfect S. I start with S in the final because I'm building that off of it. Cat, boots, then you can move over. Boots, sip, so that you can feel where you're supposed to be. So that's called co-articulation, using something that you have to learn a new skill. And that's another thing I said with K and the R, I always do that. Back chaining, this is very interesting. So those blends, I didn't get into too much, but you kind of saw it. Stop. If they, a lot of kids might just be like top. My dad always says I said that, and I'll be like, top it. But, so we want to drag out, you would start off by having them say top. Good, top, top. All right, now let's do an S. Stop. So you do what they have, and then you add on more, and that's called back chaining. People do that with all sorts of stuff in physical therapy. They gave us a lesson the other day, and they show like, okay, like if you're gonna go bowling, let's just start by throwing the ball. Then you can add more steps to it. And that's how these speech tips work. So the age of acquisition for sounds, so that is by what age you should have what sound. So when you're 2, you should have those easier sounds. H, P, N, D, B, M, W. Those were all those sounds that I said are the easiest ones for me to teach because they're the easiest ones to learn. So that's why you should have it when you're younger. Then you get up a little bit older. T, H, and R are those later sounds is like those middle sounds by then.
Can you pause for a second?
Yeah.
If anybody wants to work in pediatrics and you're interested in being a good therapist who can refer to speech therapy when you need to, this slide, man, right? If you're treating a 4-year-old who's not currently seeing speech and you're noticing that they're unable to say their F's, their T's, their Y's, then you're gonna go, oh, they're at a 3-year-old level. Should they be referred for services, right? That's us being the best therapist we can be.
And my coworkers do it all the time. They're like, this kid can't really do an X. I'm like, well, they are too. So it's fine. But so yeah, this is really helpful. I reference it all the time. I show it to parents. I like this chart. I think that's a good one. So now we can get into fluency a little bit. I actually just had my first fluency evaluation the other day. She was a 5th grade girl. She knew what she was talking about. She didn't stutter, in my opinion, but she clutters. So I didn't put anything on it because I made this before I saw her. When she gets very excited, she talks really quick and she bursts all the words together. She can't think what she's going to say. And her mom's like, I don't know what you're saying. So I'm excited. She's a new project for me to learn about. I've been doing a little bit more research. Some of the other things that you might hear with stuttering is like, today is one, or you might be like, because I and you do phrases, or you might just be like, and it gets stuck in it. And that is that tension that I was talking about. You can get very tense in your vocal mechanism, and it makes it a lot harder to talk and do stuff and communicate. So my fluency teacher in grad school was a saint. I love that woman. She was so nice. And the main things that she told me, and I will apply this whenever I have it, is that you need to make them feel the most comfortable. You can't cure it because it's just something that happens, and there's not an exact reason why, and you just have to make them feel good about it, make them find strategies to lessen it, and overall just feel comfortable in it. Because if you lean into the stutter a little bit and it doesn't bother you, doesn't freak you out, doesn't stress you out, you can move on. But if that rocks your world, it rocks your world, and it makes it a lot harder to talk. It makes you a lot more nervous to do anything. I definitely wouldn't be up here talking to all of you if you felt like that. So it's an important thing to keep in mind of. So if you ever have somebody who stutters, be patient with them and never speak for them. Don't finish their sentence. Just, make them feel comfortable, make them feel heard. So like here, the impediment, the fear, the avoidance, the hiding. If you're hiding it, they might tap their foot. They might be like banging on the table. There's so many strategies that people have, but they just, sometimes can't get it out. So now here's another big one that would be great for you guys to see. Now we'll get into a little bit more language stuff. You'll be seeing more of this. So by 3 months, that's when you're making sounds. You're exploring the track. You're blah, 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 blah. In 6 months, that's when you're babbling. You're making more skilled sounds. That's like ba, 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 da, 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 blah, blah, blah. So that's more sounds. But by 12 months, that's when you should get your first word. 18 months, that's my favorite. You guys know I have a lot of those babies in my life. I've seen them all. I love them, but I love them at 18 months. They know who you are. They know they have arms and legs. They're moving. They have some words going on. That, in my opinion, is when they become pretty cool. By 2 years old, you should be able to put 2 to 3 words together. That is, want that, like this, I see. By 3 years old, you can ask some questions. You have a big vocabulary then. By 4 years old, you should be able to communicate pretty well, and by 5, you're pretty much in there. So it's interesting. Not being very specific there, sorry. But so now language impairments. So these are the scopes that we cover and that we look into. So the first ring is pragmatics. That is your social skills, the way that you use language, how you communicate with other, your body language. Semantics is what your meaning is and how you put your sentences together. Syntax is your word structure. So yeah, semantics is what you mean. Syntax is your word structure, how you build those sentences. Morphology is how you build the words. Phonology is the sounds you make, and then phonetics is how they come out, pretty much. So it's a lot of stuff going on, but like for morphology, for example, there's the word cat, and then there's the word cats. S is a morpheme, cat is a morpheme. Cat is a free morpheme because it's a word on its own. S is a bound one. So somebody would be like, I like cat, I want cat, but so they're missing one of those morphemes, and we're counting MLU, which is like morphemes per minute, or per utterance, being length out their ends, and that's what you're looking for to see like how their sentence structures work. So in simpler terms, you're going to look for form, and that's, you know, how you make the sentences. Content is what it means, and use is how you use it, how you're communicating with people socially, and what you're meaning by it.
And go back for just 1 second. And where we overlap is definitely going to be in use, right?
Mm-hmm.
Because we deal a lot with socialization and social skills for certain populations, right? And so we might have like co-treatment over use and social rules and something like that, right?
Mm-hmm.
Cool.
Yep. So then milestones that we're looking for. So there's two main categories. There's the expressive language, and that's what you're saying, and receptive is what you're understanding. So for expressive kids, a lot of times we're doing asking questions, naming objects, using gestures, facial expressions. And then for receptive, that's following directions, understanding what we're talking about. So like identification, labeling. That's what we do with a lot of them. Starting up, understanding a story. So those are the two big scopes that we're looking for. Sometimes they're mixed, so the kids have problems with both of them. Sometimes it's just they can't say it, but they understand everything. Sometimes people can say everything all day, but they just cannot process what you're talking about.
Does anybody remember the names of the language centers in the brain? Oh my God, neuro. Yep.
Oh.
You said Broca's and Wernicke's.
Yeah, we'll get into that a little bit more too.
Oh yes.
Yep, we talked about that.
Yes.
So I found this on a Facebook page that I'm in, which I can't recommend enough when you guys start working, is Join Some Pages. I read articles every morning when I'm just laying in bed. I see stuff that's cool, and I've been sharing it with all my coworkers. They really like it. But this, I think, is very cool. A lot of times you'll see parents that want their kids to know all the colors, all the numbers, all the letters, and they have to say please for everything and thank you for everything, but there is no content to what they're saying. There's no function. So let me just read it so I get it. Pretend you have a flat tire and you call and say black circle. They probably will not understand. However, if you say help, broken, stuck, hurt, then the emergency responders would know something is wrong. So my key sentences are I see it, I like it, I want it, I got it, and that's what I say to the parents all the time, because I'll be modeling stuff. I'm like, okay, do you want orange or pink? And the parent will be sitting with them, pink please, and I'm like, no, want pink. You want pink? Here you go. And that's what I say, or like, my turn. We want them to build these sentences so that please doesn't mean anything to a 2-year-old. They don't know what it means. But if they say want pink, that is them putting two concepts together. So want pink, that's not really putting two words together. Want pink please, not really putting it together. Want pink is putting it together. That's building the sentences. It's helping them learn how to form stuff together. I see, I like. I do this all the time with kids so that they can learn these sentences. The OTs always think that I'm crazy because this one kid has a goal that is to use language 3 to 4 words when protesting. So this kid, he gets frustrated with stuff and he'll scream and that's it, or he'll push you away from it. So he rides a bike around the center and I will hold on to the back of it and I'll be like, let go, Mary. And then when he says it, I let go. Or I'll block his bike pathway, move over, Mary, and I'm like, here you go. But then this is nothing against them. We talk about it all the time and I love them so much, but she's always like, I want the pink one, please. I want you to move over, please. And I'm like, he can't say that. He needs to be, and it's not always polite, right? It doesn't have to be. You're not always polite either. You have to be able to know how to say it. So that's my big thing I always say to people is they need to be able to learn how to do this, and then we can kind of work on the politeness, because I'm not going to be talking to them rudely. Move over is completely fine in my book, personally. But so that's just one thing that I hope that you guys keep in mind is the functional language of what the reason you want them to say something is for. So we use a lot of different boards. I love with kids that are, working on yes, no, having something like this so that they know. And that's like an intro to AAC. And then same with this. If I play Zingo, I love that game. So then we do like, I got a bunny. And then sometimes I'll be like, do you need a bunny? I don't need a bunny. So sometimes the pictures don't always line up, but they know to mark the words. So it's really nice, and I like playing games like this that are repetitive. Guess who? Do you have any? Because a lot of kids get have and has confused. Do you have any earrings? She has earrings. Just those back and forth is so good for them to learn the skill, get a lot of trials in, and it's a fun way to do it. And then visual schedules are very helpful for some of these kiddos, like first this, then that. So many people have such issues with transitions. If they know this, they'll trust you, they see it, they believe it. So definitely believe in visual schedules. Now we'll get into AAC a little bit more. This one is one that I actually created in grad school, and it was for my friend's dad who has since passed, but it was very meaningful to me making it because I studied him I secretly did, and I sent it to her after, and I was like, okay, I want to get him an AAC device. I don't even know if this is legal, but let's find him one. I'm like, I don't know if I can submit this, but I had a project, and I did it on him. So the biggest thing that drives me crazy is when these kids get AAC devices, and they'll come in, and it's a grown woman's voice, it's a 4-year-old little boy, and you go into the clothing button, and there's a bra button. I'm like, who gave this to you? Because it should be a voice that kind of matches you. It should be color-coded. It should have pictures on it that relate to you. So this one I think is so good. I'm very proud of it because it's very functional. Now with the older people, you don't have to worry about them building their sentences up as much. So this was a grown man. He didn't have to do I want this. With younger kids, it's better to have one like that, and I probably should have attached a picture, but you guys have all seen one. I want blue ball. That's something I'd be doing with a younger kid. With him, he needs to get his message across. And you're allowed to say whatever you want. You do not have to always be polite. So yeah, I wrote, this sucks, because he's allowed to say that. He's a grown man, and that should be something he has access to saying. Another big thing on these are the iconicity. These are pictures of his family, of his dogs. This is a little bit to me too. I love hot sauce. That's the hot sauce I want. I put that picture of it on there on purpose. He liked Miller Lite. Miller Lite is on there so that he can ask for what he wants. Some kids like Thomas the Train, and it will just be like a vague picture of a train. You can download a picture of it and put it on there. Then color coding is so key so that it makes it easier for you to navigate through it and go quicker. So that is just very important to me. So keep that in mind if you ever see a device. You can always talk with the speech therapist on your team and be like, maybe we could ask if we could keep this for a couple days and we could revamp it for it. Personalize it to them. Make it so that they actually use it. A lot of the parents will come in because I'm with the younger kids and they'll be like, they don't really use it. I'm like, well, take some time and make it something that they would want to use, and then they will. It's harder for them, so sometimes I'm able to keep it and do it at work, but not everybody has the time for it, so you have to also teach the people how to do it so that they can be held accountable, because we are a team. It's not just the speech, it's not just OT, the family's in on it, the kids in on it, everybody should be working together, and that's how you will get the best results. So here's another question that I have for you guys that we had to ask. So just think about it for a second, and then whenever anyone thinks of it, if you could only say 5 things, what would they be? Right? Because some of these people, they can't really say anything. So if they have a device like this, so let me know if anyone has any ideas. When I wrote it down, I wrote, can I have a side of hot sauce, please? Because if I want to eat something, I want hot sauce with it. And that's something that I would have to be able to say. So,
yeah, what do you guys think?
What does anyone think? Anyone have anything that comes to mind? Yeah.
I'm hungry.
That's a good one. But so you can only say, I'm hungry. You can't really say what you want either. So I want a snack. But it's just very something you have to think about, how you can get these messages across. What about you? What do you think?
I have to go to the bathroom.
That's a good one.
That was my first one,
Mm-hmm.
especially as OTs, right?
Yeah. I don't like that too, because You know, you have to be able to communicate that. There's the yes and no. That could be a little bit vague. But yeah, so you, as an OT, you know, moving forward, just keep that in mind about your people, who you're taking care of, is like what they would want to say and what you would want to be able to say too.
Pause for a
Yeah.
sec. We're gonna take a short break. Everybody just take 5 minutes if anybody needs to use the bathroom. And then we're gonna come back and we're gonna keep going. Cool? Great, cool.
Cool.